All right, everyone. Welcome, everyone. We are joined here by several folks. I'll introduce in a second. So, first of all, wanted to say I'm humbled to see over 450 leaders in the healthcare space who are registered for today's event. And today's focus, so it's on practical use of AI in revenue cycle management, a very hot topic. Today's focus will be on some of the key challenges in RCM, the future of healthcare operations, one very hot topic, AI agents and how they're impacting healthcare administration, and of course, AI within payer workflow. So, just quickly, in terms of challenges, I mean, we from prior auth to claims processing to denials management, there's so many areas that are being impacted today by AI and automation. And I think even at a deeper level, the real reason that we're here is that this matters in terms of inefficiency. It's not just like, oh, we want to optimize things. It's that when there is inefficiency in the healthcare industry, if you're a provider, it causes delays to patient care. And many of us have loved ones that have had unfortunate experiences within the healthcare industry due to these delays. For example, a prior auth. If a patient needs a prior auth to be able to afford an expensive or necessary treatment, there have been times you have to wait 6 to 9 months or more for that. So it's something that it's affecting people. We have a duty to use this kind of innovative technology like automation, like generative AI, to help humans with these tasks that they simply shouldn't be doing. So, with that being said, without further ado, let's start with some intros of our panel. So, for myself, my name is Gabriel Skelton. Some of you may know me. I am the head of artificial intelligence solutions at OpenBots. OpenBots is the sponsor of this event. Thank you, OpenBots. And it's an automation platform designed to handle unstructured data and take over the data entry into EHRs and within payer portals like Availity and United Health and BCBS. Now, let's start with you, Stephen. So, Stephen Kamalik, you have a deep expertise and background in lab and diagnostics. Take a second to tell us a little more about yourself, Steve.
Truly, thank you. Appreciate you. And I appreciate it's an honor for me to be here as part of the panelists. Looking forward to this for a long time. So my name is Stephen Kamalik. I'm the CEO of a medical laboratory, multiple locations throughout the country, based out of New York. Just left the position as a CEO of a lab based out of Kentucky, with also multiple locations. Been in the healthcare industry my entire life. Our biggest challenges is our revenue cycle management. We can do the work, but we need to get paid, and so we look for alternatives and other ways to help and assist with getting paid. So,
I love it. Thank you, Steve. Very
thank you.
happy and pleased to have you. All right. Justin, let's go to you. So Justin has a very strong background within patient access, within RCM, specifically within medical equipment manufacturing. We have a lot of similar challenges to typical providers as well. But go ahead, Justin, talk about your background.
Thanks, Gabriel, and good morning, good afternoon, everyone. I'm Justin Kelly, and I lead patient access for Noctrix Health, which is a startup in the Bay Area that was a spinoff from Stanford Biodesign. We have a technology that's FDA approved for drug refractory restless leg syndrome, and I lead the reimbursement revenue cycle efforts for the organization. Been working in this space for many years, have launched multiple med tech home use devices, and look forward to our conversation today.
Absolutely. Thanks, Stephen and Justin. All right, let's move on to Jonathan. So, Jonathan, you formerly used to work for Nicholas Children's Health System, for Baptist Health, and other orgs. I mean, you have very deep RCM expertise. We've sat down a number of times. But Jonathan, tell us a little more of your background and how it ties into this.
Well, thank you. So currently at Accelerate, I am a senior solution process architect. So what my role is here, I work with healthcare organizations, mainly within the revenue cycle space. I identify opportunities to include process automation and AI capabilities as ways of streamlining their current workflows. As you mentioned prior to that, I have 17 years of experience as an analyst within the healthcare IT space, working at both Nicholas Children's and Baptist Health. As an analyst, I was supporting various leaders within revenue cycle departments, so I've gotten to understand a lot of their workflows as well as the many technologies that they utilize to complete their day-to-day operations. So I'm excited to be here, and thank you for the this opportunity.
Absolutely. Thank you for joining, Jonathan. Alongside you, we have Ahmed, we have to call him the big gun, special guest, Ahmed Zaidi. So you have over 2 decades of automation experience, multi-talented, but talk about your background as well, Ahmed.
Sure. Thank you so much, Gabe, for inviting me on this. Really, truly honored to be on a panel with folks who have a lot more experience in healthcare and dealing with this stuff than me. But I am the CEO at Accelerate. We are an automation and AI company. We have had a focus on healthcare, both on the payer and the provider side, for quite a while. Um, when this thing came up, Gabe reached out. I said, "Oh, that'd be great," because I do see there's tons of opportunity from a efficiency standpoint, and especially with the current advancements in AI, especially with LLMs, what you can do today is much more efficient, and the capabilities of the technology are much higher. So I'm excited to be talking about how we can reduce inefficiencies. Just healthcare is an industry that, especially the provider space, is really something that makes an impact, right? I've been in banking for quite a while. Yes, we thought money was everything, but as I delve more into healthcare, the impact that we make on daily on people's lives is rewarding, to say the least.
Thanks for joining, Ahmed. I hope you can help us decipher some of the newer topics like agentic AI and those kind of things. Last but not least, we have Zia Buddha. So Zia will be the host of this event. He's a serial investor within the automation and agentic AI space. Zia, I'll kick it to you.
Thanks so much, Gabe. Much appreciated. So I am a technology investor. I'm the CEO of a company called ANI Capital. Before that, I co-founded and founded multiple technology companies. Healthcare has always been a very interesting space. It's a very highly regulated and a chaotic industry just because of the very nature of it, and it's almost always behind the technology curves in many ways. And one of our objectives and one of our investment thesis is to invest in companies that focus on a more efficient healthcare system and a better patient care and a patient experience. So excited to be here. Thank you so much again. So again, I'd like to extend our welcome to all the fellow panelists. All of these folks are executives from healthcare and technology industries, and so today, as Gabe mentioned, we'll talk about healthcare operations and more specifically about the applications of AI and automation within the healthcare space. As always, everything in healthcare should start and end with patient care and patient experience. I'm a very firm believer in that. Every healthcare provider, I think, strives to provide the best possible overall patient care as well as giving the patient a seamless experience. And technology plays a critical role in that. But healthcare industry is, as I kind of mentioned before, is highly regulated. There's no shortage of administrative and compliance challenges, and especially when you're trying to get paid as well from the insurance companies. The industry is also fragmented, which makes those challenges even more pronounced. So let's get right to it. I have a bunch of questions, and I'm gonna start off with a little bit on the operational end of it, and just kind of like get an idea from the business leaders in terms of the types of challenges, high-level challenges that they face within their overall revenue cycle management side of the operations. Things like overall patient experience, data integrations, which is always a pain. Just again, because the US is not a single payer system, and it's a lot of systems don't talk to each other. Faxes are still a reality, believe it or not, in healthcare. You have high claim denials, billing errors due to coding issues, compliance and regulations, and many other areas. So we'd love to get some thoughts from our panelists about some of these challenges in your world and how you guys are tackling these issues. So maybe we'll start off with our industry veterans. Steve, maybe we can start off with you first.
Yeah, thank you so much. Appreciate that. Generally, in our revenue cycle management challenges, we suffer from lack of good coding, good ICD-10 codes to match the diagnostic codes to match the procedure codes. obviously always suffer from denials and rejections. You perform the work, you send out the claims, and they get denied. Um, I always like to say that we work in the 6 month cycles in the healthcare industry. You get your first launch in January of new codes, and then in July you get the next launch of new codes, and then you get the in-betweens that come up. Like yesterday, United Healthcare posted out that they're no longer paying for a certain test. And then what will end up following suit will be the other insurance companies and then Medicare as well. So we're always chasing codes. That's our biggest issue. We're always chasing the right codes. So sometimes when we have access to EMRs, it works well. Sometimes you don't have access to EMRs, it doesn't work well, and you're going back to the old techniques of, as you stated, fax or phone calls. So those are the challenges that I foresee in our industry today.
Very interesting. So, I think when you talked about coding and ICD-10 codes and procedure codes, and I think AI can play a pretty interesting role in that. And as we kind of proceed through our discussion, we'll
Without a doubt. We at a previous company we work with we worked with OpenBots, and OpenBots developed a couple of bots for us that ended up helping us search through EMRs to find the patient's name, find the codes, go back. It saved a lot of time. It saved a lot of headaches. It helped reduce some of our denials as well, and some of our workload as well. Where I would put 3, 4 people on searching for codes, I only had to put one. So it would certainly help in that manner as well. It makes us more efficient.
Excellent. Thank you for that. Justin, any thoughts from you on this?
Yeah, I have a lot of similar challenges to Stephen. I think launching a novel medical technology with miscellaneous codes and really sort of grinding through that first initial launch period. Some of the biggest challenges I heard from the team were long hold times to do phone transactions, to check on a prior authorization or get benefits and be waiting on hold for an hour, waiting to speak to a human. Or to get that information, portals that vary in terms of their usability and capabilities with the various payers, and also finding a way to get an early warning system in place, to identify payment challenges, like if you have a new contract that wasn't loaded correctly. A lot of times that can take months to show up in EOBs and mail, and so find a way to sort of get in front of these issues before they turn into large problems that take a long time to unwind.
Yeah, I like this concept of early warning system. I think that's another AI use case that you can, that possibly can be implemented. Jonathan, any thoughts from you?
Yeah, so just thinking of my experience back at the hospitals, thinking from registration alone, that there's so much that the teams need to keep in mind. Obviously, like you said, patient experience is at the top of mind, but it's all the checks and balances that they need to ensure of the process. Like you said, compliance regulations for a patient coming in, did they collect all the appropriate information? Did they get their prior auths? Did they scan in your, documentations? Have consent forms been provided? And it's not just all happening within the EMR. You have to go to maybe your payment system or your other application for digital signage. So there's just so much that the teams are responsible for. Shortages, we all know, is a big thing, and then there are more and more patients year over year. So I just figure that there's a lot of responsibility on those players, those staff members, that they need to kind of keep in mind that there is always an error that's going to happen, which is why, like you mentioned, denials can occur because maybe a prior auth was missed or something wasn't properly verified there. From a coding perspective or back end of the house, there's a specialized expertise that needs to be obtained. So all your coders have to be or should be at least certified medical coders. So depending on the size of the organization, they probably need a significant staff size to handle the volume that's there, which it might not be available within the country. So then you have to go to either vendors or even outsource all that. So yeah, there's just so much happening at a given time within this industry that my hat goes off to those staff members that are doing all that workload, but I see that there is a huge opportunity for technology to really assist and support those needs.
So let's talk about we talked about the coding in one of the areas, one of the major areas. Let's talk about people, process, and technology. So we all know technology plays a major role in some of these challenges, but we know that technology will not solve all the problems unless the processes and people are not adapted to it. So let's talk specifically in the context of coding. With coding, obviously training plays a role because you've got new codes coming out. You've got to, train your staff all the time on this. So I think some of the audience is curious about in terms of how much gap is there in training and how much of that gap can be addressed with technology and possibly even, AI for that matter. So any thoughts on that? Maybe we can start with you again, Steve.
Sure. So it took us about 4 weeks to get the bots up in place, and then it took us about another week to get trained. And once we were trained, we were able to tackle issues very, very quickly. We were able to address issues in a more timely fashion. So we didn't find a very large gap. Even today, my current position, in my current company, we don't have an issue with gaps. We are using AI right now here, and I think that once the bot's been trained, once the personnel have been trained, and they understand the usage of it, it kind of is almost a seamless flow. There is some back checking that you have to do, and some stuff that I would call him a billing expert, as Jonathan relayed, that somebody that's a coder would understand and catch. So everything does get double checked, here. But I don't really see, like you said, I don't see a large time frame or a breakdown in that. So.
And Justin, any thoughts from you?
I think, for me, when I first started to dip my toe in the AI pool, seeing some of the work that I did for many years of my career be automated by digital assistants was pretty intimidating at first. And, so I spent a lot of time sort of thinking through how I was going to sell this to the team, because I think that, obviously there's you want to keep your team motivated, making sure folks understand what this is, what it isn't, getting in front of rumor mills. And, I think that we did a really good job of socializing what's in it for me for the team, and, had some successful rollouts of some of these technologies. Mayor Stevens' perspective, once the team was trained, it basically they started to see the value of the capabilities that we were bringing on, and allowing them to be more efficient and do more sort of high level work than and sort of clean up some of the sort of lower hanging fruit that can be done through automation.
So let me ask, and Jonathan, maybe you can just get some thoughts from you. So there are times when at least I've heard that when you work with some of the technology vendors, they want you to change or adapt their processes and their people to their technology or to their product, right? And in some cases, that may make sense, but in some cases, the organizations just want the technology to complement or to to do better and faster what they're already doing. So what are your thoughts on this, where you think sometimes the technology vendors go too far to kind of like redesign the processes that the companies already have? Any thoughts on this for you, Jonathan?
So, I mean, as you were speaking about that, I do recall there was an implementation where we were getting consent forms digitized onto iPads with the vendor. And with that one, I do recall that the organization, they wanted the technology to fit the workflow, um, which did make it a bit of a challenge as to kind of incorporate all the different scenarios that would take place. So I think it needs to be a healthy balance. When implementing technology, I believe that there's an opportunity to improve on an existing workflow because of what the technology can bring to the table. You don't want to include technology in a bad process or a process that's not fully optimized. I think there's an opportunity there to improve on how the business is being performed or the process performed, while including the technology to increase the efficiency. So it's going to have to be a bit of a give and take or a compromise from both ends. One, to be open to a new change to the workflow to actually, again, increase your throughput or have better results. But at the same time, from the vendor standpoint, work with the customers, meet them, try to resolve their pain points or understand where they're coming from and show them the value of how the improved process can really optimize the workflow there in general.
And a quick comment there, Jonathan, we actually just got a Q&A that ties in very well with that. So
All right.
Mr. Plazvik, he said, and again, I'll comment on this, and then anyone else who wants to comment can comment. He said, a challenge that many health systems have with implementing automation and AI is a large amount of critical data input being in unstructured spaces, formats like free text notes, clinical notes, and not in a specific reportable field. What are thoughts on using AI such as NLU and natural language understanding and generative AI to help solve some of that complexity by finding and extracting key data out of those unstructured locations? I mean, Ahmed might be the most well suited here to answer that if you wanted to comment on that.
Look, I'll take both Zia's and your questions in order. Look, I think there's something to be said about point solutions that do a point thing. If you are completely on a paper-based intake, it may make sense for you to have a point solution that just does patient intake electronically well using whatever technology and then integrates into EMR. Especially in the RCM space, look, I think the core of the operation and the core systems of record, whether that be EMR, the billing systems, or whatever that you may have in a large hospital system or a large practice, it is a very tedious task to actually train everyone and completely redo processes. So in our experience, we're seeing a lot of folks try to figure out, and by the way, just remember that these systems themselves are trying to develop point solutions for these issues. So large systems like Epic Cerner, all the other EMRs that are out there, they're also trying to develop solutions to these things. And the customers are sort of torn between, do I like just solve this now? All my data is in here. I have data integration problems. And they would really like things to be in line with their current process, right? So we've had folks who said, listen, I would love for when my coder is going in and coding for them to get a pop-up or for them to get a notification that says, hey, listen, you should consider this as well, as opposed to a report that runs at the end of the week, end of the day, that outlines and has looked at everything and then does it in batch, right? So I think inline sort of prompting is very important. And to your point, Zia, I think there's something to be said about bolting on technology solutions that will solve your problem in line with the process with as little impact to the business process, because those processes are there for a reason, right? It's yes, some of it is just legacy. That's how we've done, but then there are really real challenges. Double keying, I bring in another system. There's no API to integrate back into my EMR. How do I then have a challenge of single source of truth and so on and so forth. So I think that's really important to consider. How can you integrate a solution for specifically in the space of coding that works well with your current process and your system? We have customers who actually do multiple things, right? We have customers who have actually used us to look at just traditional AI models to say, hey, we've done these claims in the past. We have history of what gets denied, what gets paid, what codes get sent back, what are the alternative codes that we use for procedures and things like that. Let's flag them up front, and as the coder is going in, to tell them this is what you should do or this is what you shouldn't do. On the other side, to answer the question that was asked, Gabriel just asked, you're absolutely right. What we have seen. So a great example of this, we actually have a customer, and what they noticed just anecdotally was malnutrition was not coded. Hence, they were leaving money on the table by not coding for malnutrition that they could get paid for. And that information generally always existed in notes, nowhere else that was codified. So we've developed sort of using NLP, and we used a specific model that was trained on in the industry to actually look for the nodes, predict codes, predict, at least find out specific codes that could apply to that case, and add them to it, and add that into the process, so that when the coder gets there, they get a list of things that are associated with this particular case that they should look at, and guides them sort of in the right direction.
So let's talk. This is a good segue into talking about AI. So let's talk about the current state of AI within the healthcare provider space. So, you obviously have larger providers with massive resources, and then you have the lots of small to mid-size providers as well. And I'm sure there is a big delta in terms of where where folks are in terms of the AI adoption and where they're applying it. But specific to RCM, and maybe Steve, Justin, and Jonathan, maybe we can get your thoughts in terms of from a standpoint of what you have seen. Where are you seeing the impact of AI, if you are seeing it? And just your thoughts about it, because AI is still, it's one of those things. It's as somebody once said, everybody's talking about it, everybody's thinking that everybody else is doing it, but I'm very sure very few are. So love to get the thoughts from you guys in terms of the current state of AI within healthcare.
So from our industry, a few years back, AI was starting to be implemented in the diagnostic world, and what we did in the diagnostic world was we were looking at pathologists that would look at a tumor on a breast, or we'll just use breast as and they were able to identify cancer. And what we're seeing now, as this has progressed in the healthcare industry, that there are more calls for cancer because of the accuracy, right? The human eye could see so much, but the AI is picking up a lot more. And so, where we've seen a lot more acceptance. And I will tell you, from a standpoint, when I first brought out to our head pathologist that we were going to look at AI, she nearly chased me out of the room. Now she's the biggest advocate of it, and she's absolutely loving it. On the ancillary side of the business, on the revenue cycle management side, it was a challenge to get the billers to again say, hey, you're not taking my job away, right? And I would always say to them, we were trying to enhance their jobs. We were trying to make their lives easier, less time on the phone, less time in front of the computer. Let the AI assist you. One of the programs that OpenBots had done for us is, when we draw nursing home patients, there are mileage logs that we need. And the employees, they were drawing these mileage logs. Some of them were doing it electronically, but the majority were doing it on a scrap of paper with terrible handwriting. And so OpenBots, it reduced our time. I can't even begin to tell you. I was concerned that it was not going to be able to assist with the sloppy handwritings. I have sloppy handwriting. People have perfect handwriting. People that have gone to Catholic schools, they have better handwriting than I do. And what we noticed, it reduced the amount of time to look and figure out and then add up in total the exact count of, the exact mileage, then go to a Google Maps situation and AI that out so that we could see that, where the phlebotomist started, where they were, where they ended up, and how they brought the specimen back. And then to get it to the accuracy it was done was just phenomenal. I see there are challenges, right? You're going to have always the people saying, hey, this is going to replace me. And then you have the acceptance part once they start to realize, wow, my workload is really, really lessened. So I was hoping I hope I answered your question. I'm an advocate of the AI and I love it. There are challenges, but you can work through the challenges. And when you predict and you write out your workflow, which is what we did, we wrote out our workflow. We said, this is what we have, this is how we do it today, and how do you convert that to AI? And then you have a great team that goes behind and does all this stuff. It really makes for a very efficient manner in doing business.
Yeah, I think like pathology, radiology, I think there's a lot of opportunity to accuracy matters. And if I don't think the pathologists and the radiologists are going to be or the likes are going to be out of a job anytime soon, because I think AI can do the preliminary findings, and then the physicians, and they can actually build upon it. So I think I think AI just it's specifically in that area. I think AI provides a lot of benefit for an accurate diagnostics. But now, so let's talk. Coming back to one of the other things that I talk about is that when it comes to AI, there was a post, there's a before generative AI, and then there is an after generative AI world, and there's a complete it's a complete difference in terms of how things get done with after generative AI, with the introduction of these things called the large language models. There's a lot more that you can do with AI than before. So we'll get a little bit more into it. But Justin, any thoughts from you on this?
Yeah, we're sort of in the early stages of the automation journey. I would say that, from, understanding like our payer friends are using AI for various functions, prior auth adjudication, with some, potential controversy around that. Looking at ways to sort of, again, go back to what I was, saying before, is like allowing our teams to be more efficient and kind of reducing some of the, lower value work by automating that. Our big focus right now is on data entry. So, rapidly growing in terms of volume of patients, not wanting to have to, bring on multiple people to do sort of the data entry type work. We're able to automate that and, free up the time that our existing team's been using to do the data entry for other types of work. In addition, getting folks, time off of waiting on hold, so that they can do more transactions, that again don't require them sitting on hold for an hour waiting for an agent to pick up the phone, is another thing that's been working really well with our team.
A quick comment there too, as well. So as you were speaking, Justin, we received another question, Jonathan. I want to direct to you because we've actually spoken about this. So Philip Anderson said, "I work in product on the provider RCM side for several large hospital physician orgs, and one of our hottest topics of conversation is autonomous denials management. Healthcare payers are also in this AI race, as it is common for them to contract AI companies to deny claims more quickly. Just curious what your thoughts are on this battle. Where should our focus be?" And one more comment there, Jonathan. I loved your explanation of like proactive versus reactive denials management. I think it's gold for anyone who's in operations of RCM. So go ahead, Jonathan.
Yeah, so I guess at Accelerate, we're trying to get into that race too, but we want to be on the provider side. We want to help them become proactive with identifying denials as documentation takes place as the patient's in-house. So in a way, you can think we have AI as like your overall QA type of yeah, your QA analyst, so to say. So as documentation's happening along the RCM process from registration or even scheduling to, coding and all that, you can have particular areas being monitored to ensure that you're capturing information appropriately and with the hopes of preventing any denial. So do you have your prior auth information? Have you verified have you verified your eligibility and your coverages? As documentation is taking place, does this meet guidelines of the payer to ensure that there isn't any additional clinical documentation needed? You can even have it maybe do some kind of charge review or something just to make sure that your appropriate revenue codes, your modifiers, all that's in place. So we're thinking of kind of doing that to help equip healthcare providers with the tools to get cleaner claims sent out the door, because we know they're doing it on the payer side and they really want to deny those as soon as possible. So that's a big focus that we want to do, try to go ahead and get hospitals or providers to implement preventative measures. But then at the same time, from a reactive standpoint, once the denial has been received, you can have AI doing some form of a triage to identify which are the easier or turnaround or easier denials that can be turned around or handled by some automated bots, or something that needs to be called to an attention of a specific denial specialist, or it can be almost routed directly to the department that would provide the necessary information to go ahead and appeal and resubmit that denial. So yeah, there's a ton of use cases there, and we can kind of, better equip healthcare organizations to kind of defend themselves as well.
So I have one question for you. So one of my neurologist friends, he was telling me that in the last year or so, some of the transcribing and some of the notes that the doctors have to document. He's been using Chat GPT type of technology extensively, and none of that was possible, before 2022 or before this whole generative AI thing came in. So maybe you can just tell the audience a little bit about, what your thoughts are in terms of, the AI world before generative AI and after generative AI, and what the implications of generative AI are to the healthcare provider space specifically, as compared to what it was before.
Perfect. I think when you ask your initial question about AI focus in healthcare, if you go to some of the large organizations, I think you'll find that I would call it a renewed focus, right? Large healthcare organizations have been doing a lot of AI in the background. The traditional machine learning models predicting mortality rates, predicting occurrence of disease, predicting denials. I mean, the model that I spoke of is a 6-year-old model, right? That predicts the probability of a denial looking at the stuff that's on a particular claim. It has nothing to do with any of the stuff that's happened in the past 2-3 years. It's your good old traditional take a bunch of data, train a model, and try to predict it with new data. What has changed really, I think, is the ability of AI models to understand unstructured data a little bit better, number one. Number two, the ability of organizations to deploy these things, which you would have done in the past with a tremendous amounts of training and this and that, especially the natural language stuff that has really been a bane. I mean, honestly, natural language understanding of unstructured data has been a pain for a very long time. And if you come down to it, it ends up being some of the very simple stuff. I got a lab report that has an A1C result on it. It's unstructured. It's from one of the 15 labs, that don't send me EDI. Just didn't have anything that could easily look at a lab report and say this is your A1C result, right? It sounds trivial that it's not a big thing, but it actually, based on the volume, turns out to be a big thing. And traditional models didn't really perform well in handling this unstructured data, and especially data in the clinical space, as you mentioned, or even in the claim space where doctors are writing notes, you have reports, you have summaries, you have visits, all of this stuff that's coming in, and being able to meld it all together and make a decision. I think that's become much easier. So to your point, I think there's a renewed focus on AI to see what can we augment to what we've been doing with the traditional AI models of capturing data. I mean, every large hospital system, if you go out there, probably has a data science team, not a big one, but one nonetheless that does all sorts of different things based on specific cases, whether it be image processing, as Steve mentioned, yes, radiologist, a good friend of mine is a radiologist. He says, today when I get a scan, the AI actually puts a priority on something that it predicts has a serious condition, right? So it's being used now, but I think there's a renewed focus, and I think that there was a couple of questions around this as well. The big focus is now how can we actually understand and make structure out of the text and the narratives and the be it the doctor's notes, be it the nurse's notes, be it any of those unstructured free-form text fields that are out there in your systems, and how can we make sense of it, get data out of it, match that up against our traditional models and the new LLM models to make things more efficient. I think that's the big change in the past 2 years.
So there's a big time to market advantage
Absolutely.
with the generative AI. So, all right. So, Steve, Justin, and Jonathan, a question for you guys. So let's talk about AI snake oil. One thing that we all see, is that every little product or service that's out there these days is now, is now gift wrapped with AI. And the vendors talk about all sorts of AI capabilities that their products have, and a lot of that. So how do you, from a business standpoint, when you are, you guys have obviously dealt with different types of vendors. So how do you determine, a vendor just promising the AI magic, and how do you determine that they have the credibility to provide, and the value that they're promising? What are kind of like high level things that you would think about? I think that would be a good input for the audience here.
So I'll jump in. We did our homework. We invited several vendors. We listened to their stories. We listened to what they could do. We stood by our, if it sounds too good to be true, then is it really too good to be true? And we worked, like I said, we worked out a workflow that we wanted, and not being dictated to us by the vendor. So we were able to give a workflow, send it out to the vendor. The vendor came back and did a couple of demos, and we went from there. I don't find AI to be, snake oil. I've followed it for many years. I attended many conferences on AI, and especially in our industry with the pathology world and other stuff. And I find it to be very advantageous. It's here to stay, right? It's not going away. Whether you embrace it is going to be up to you and your organization, or your hospital. I think that with the new trends coming out, with the new codes coming out, new information coming out, AI will assist with that. And again, once people get over the fear of, hey, this is replacing me, it's endless from there. And again, like you said, it's all about efficiency, making the workflow flow easier. Eyes are good, but sometimes automation helps. I listen to Jonathan, and I really get myself all nervous, because you put out a bill, and you put out something to send to the insurance agencies, and they're knocking it back. I was trying to run statistics before getting on the call. What we saw was a 40% reduction right now, and that's a quick analysis on claims that were getting denied, because we've now put them out as cleaner claims than we did before. What I find more on the AI side, on the diagnostic side, is that our doctors are more efficient. They're able to do more stuff, and they're more engaging with another physician, or they're able to have more freedom and more time to have that discussion. Hey, this patient has cancer. This is where I'm seeing it. This is where you need to go. I see, I see generally, like I said, I just see our physicians more engaging. On the revenue cycle side, I see our staff a little less stressed. I don't see them waiting on the phones. That was always the big thing. Is like, Steve, we're waiting on the phones, 30 minutes for somebody to pick up, 20 minutes for somebody to pick up. And that gets reduced out because we're sending out cleaner claims, more efficiency. So, like I said, I hope I answered your question. I don't think it's snake oil. I do think that the workflow needs to be worked out. And then you have to really look at and investigate with several vendors. Don't rely on one vendor.
Absolutely. Justin, any thoughts?
Yeah, so I mean, when we started to work with different partners in the AI space, I really defined some specific use cases that we were looking for help with because we can boil the ocean with multiple different solutions. As we went through this process, we were able to sort of, it started really generating a lot of ideas that now are sort of folding into future opportunities. So we started off with, how do I help my team spend less time waiting on hold? So they can get more transactions done that require speaking on the phone. And also, how can I, reduce, the cost to do data entry? And, through that, we were able to start to look at some different use cases based off of this. So like, for example, we're looking to summarize medical records. I'm a nurse. I like to go into a case if I'm like arguing a hearing or I'm going to be talking to the physician about the patient. I want to get a Cliff Notes, version of what's going on with them, from the medical records, without having to review, 20, 30 pages of history and physical and chart notes, so that allows us to get, 96% of the way there. Other things that we're looking to do with this is build predictive models so that we can support our patients better. We're at a very novel indication, working with patients that, we're getting a lot of learnings. So how do we socialize those learnings and adapt, to be able to provide better support to the patients? And part of that will be looking at, what's in the clinical record and are there specific things that we've seen with the other patients we've worked with that, may require more additional support or may need additional handholding so that we can prioritize the right support for the right patient at the right time.
Jonathan, any thoughts from you?
Yeah, I would say one of the key, I guess the key things to have is when selecting a vendor is how well do they know the industry
Yeah.
that they're trying to sell. So healthcare, because I mean, there are tech companies out there that sure, they might know the technology well, but then you might come across that scenario like we mentioned earlier, where they're just going to try to shove the tech to the industry or to the business unit or area, and it just becomes such a combative experience or not even an enjoyable one. Um, I'll be honest, it's even part of how I came to be here. There was an experience like that with the previous vendor that it was still process automation, but the experience between that vendor and the customer was just not well. The customer felt like they were training the vendor so much that like it wasn't they weren't even they didn't want the technology to begin with. Someone like me comes around who can actually resonate with those leaders, with those staff members. I understand how the process is. I can speak their lingo. I can show them or introduce them to the technology so that they can understand the value of it. Now we have a perfect marriage and then everything is going smooth. For me, it feels like it's easy because I'm talking to those that I've worked with for so many years. And now I'm getting them to expedite their processes and optimize their processes with the process automation. So I'd say, to kind of listen to what they're talking about. Do they really know the industry or the area that they're trying to implement this technology in? And yeah, I think that's something to really keep in mind because yes, the technology's out there. A lot of people are in this pool of AI and trying to attract business, but how well do they know it for this industry?
Excellent point. All right, so I'm gonna let's predict the future now. We've all been looking at the progress of self driving cars, and Elon Musk just showed us the future of the robo taxi, and as you know, Waymo robo taxis are are actually being, utilized in places in Arizona and California and other places. And so I guess if we map that to healthcare operations and healthcare RCM operations, how many of you, or how many of you think that the concept of straight through processing, to a certain extent within the overall revenue cycle management, can become a reality? And if it can become a reality, what path would it take? Maybe Emmett, we can start with you on that.
I think I've spoken to you personally about this quite a few times. I'll say it out loud for the audience. Um, I really think so. Again, the promise of full FSD, whatever Tesla calls it, right? Full self-driving vehicles has been there for what, 10 years now, I think. People have been talking about it. It's not there. It's not there. What I do love about my car is that it tells me you're going out of the lane. You're not paying attention. It slows it down when there's a car ahead that slows down. It stops automatically when I try to back into my kid's basketball hoop. So those guardrails are really helpful to me, and they make me a much better driver and a more efficient driver, right?
Yeah.
I think the future is, so in my opinion, trying to do straight through processing in an extremely complex environment with unstructured data, with rules that are a lot of times can almost be subjective, using a technology that inherently is non-deterministic to begin with is a pipe dream. If
Yeah.
you're really looking for, I'm going to use this non-deterministic technology that says, I think this is the right answer, and I'm going to get 100% straight through processing, I would like to have whatever you're having. From that perspective, I think what I really believe is that these technologies, including robots for that matter, that work on straight rules-based things, the key is efficiency. Am I doing this thing more efficiently than I was doing yesterday? Even if I am looking at 100% of the cases, am I spending less time on them than I used to before? Can I process the same amount of cases with the same amount of people, more amount of cases with the same amount of people, or fewer people? I think efficiency is the game. The future looks like an assistant that sits on the side of my desktop, and I see something and I say, can you take care of this? It says, oh, great, I'll do all this stuff. You think this is right, and done, right? That's what the future looks like. Just like when I go and park my car next to the parking spot and press a button, say, can you please park it for me?
Yeah.
Right? That's what, in my view, the future looks like, that more so than a fully self-driving car, and I'm turning around playing cards with my friends. That's not what the future looks like.
So incremental efficiency gains, utilizing.
Actually, and I think those incremental efficiency gains can be extremely impactful. I am seeing 30, 40, 60% efficiency gains in doing simple tasks, which for service providers like us, I think it's going to be a boon, because these are micro tasks that need to be automated, that can look at a image of something and transform that into a structured table that I can paste into an Excel spreadsheet and send it to someone. That in itself saves me, let's say, 5 minutes of typing, and if I do this 20 times a day, yeah, I've saved tremendous amounts of time.
Excellent thoughts. Steve, Justin, Jonathan, any thoughts about where do you kind of see the future of
Well
RC?
said, Ahmed. Well said. Technology is an always ever evolving situation. I got gray hair for a reason. Remember when Windows first launched and where we are today with our Windows program, right? So, and remember the acceptance back then really wasn't accepted until people started to realize the ease of use. So I see that once people start to see this as, I like to use the word joint venture with their job, their task for the day, it becomes much more accepted. And again, I'll say it again, the world is ever evolving, technology is ever evolving. With that, our industry is ever evolving, right? We need more physicians. We don't have enough physicians. We need more billers. We don't have enough billers. We need more customer service people. We don't have customer service. I'm starting to look at AI to answer my phones after 8 p.m. at night. And I've met with several companies and I looked at different things. I didn't in the beginning. I was like, "There's no way that this is even going to happen." And then I started yelling at the bot, and I started cursing at the bot to see what the reaction was, and I got great feedback. It didn't curse back at me, so which was really cool. But it sounded like I was talking to a human being, and after the bot apologized and said, "Let me try to help you," and I was amazed, and so we've narrowed it down. Again, the future is here. It's here. It's in our hand. Embrace it, but utilize it to what your needs are. Don't utilize it because it's there. Utilize it to what your needs are. And your staff will figure it out. I know my staff has, and I will tell you that in the beginning apprehensive, now all over it. All over it. And so that's that's my statement on the future.
Well said. Justin, Jonathan, any closing thoughts from you guys?
I would just say that as someone who, a year ago hadn't used any AI technology in my day-to-day work, it's been a pretty steep learning curve, but also an exciting project to work on because, as Stephen said, it's here. There's lots of uses that it could be applied to, really tailoring it to the specific needs that you have today. And then once you start to see the capabilities, that really gets your juices flowing and thinking up new ways to potentially use these technologies to make your team's life better and also improve their productivity.
Thanks, Justin. And Jonathan, anything from you?
Yeah. I'll just say I think what everyone should at least try to think of it as that these technologies that we're talking about, these are tools that are going to just assist throughout your daily processes. I know when the word AI or it's heard of, everyone just automatically thinks it's going to replace me. But really, just like any other technology that's come over time, it hasn't replaced anyone. It's just making people making processes more efficient. So once you start seeing it as something that's going to assist you during your day, it's a game changer. I can. I know everyone's inundated with work as it is in the healthcare space. What is it? Burnout is a very true thing there. So if there is an ability to actually start taking on that workload that's there to kind of give people the breathing room, I don't see why there would be such hesitation to do so. From my experiences, I have in the year of being here, I've introduced RPA through to several departments in RCM, registration, HIM, clinical documentation. We've started small just because I do know there's that hesitancy to adopt it. So I've picked on a process that was small, but something very repetitive, very time consuming that they're having to dedicate a lot of resources just to even at times obtain results and then take action on that. So I said, let's go ahead and get automation to obtain those results for you. We talked through the process and all that. They understand it. Once they're seeing that they are saving so much time, they're getting the information much faster. It's a godsend to them now. Like they've now adopted to that mindset of, okay, this is working with me and it's not working, it's not replacing me. So I think the future is bright. Healthcare in general is so primed for this type of technology. And if you have all these digital agents or all these digital assistants working, handling that type of workload, the healthcare staff alone can now give that patient the better experience, really give them that catered and tailored experience to now kind of keep patients coming back to your organization while also focusing or operating very optimized and efficiently. So yeah, it's a true tool that can elevate an experience at an organization and kind of take you all to the next level, really while just being another tool in the tool belt that you all have.
Well, I want to thanks, Jonathan. I want to thank Steve, Justin, Jonathan, yourself, and Emmett for joining, and Gabe for hosting and giving us the opportunity. I think some of these topics, I think there's we can probably go, the RCM, the healthcare space, the RCM space itself is so big that I think it would be interesting for us to actually go deeper into some of these areas specific, with specific focus on some of the some of the smaller topics within. So, but I really enjoyed the conversation. Thank you so much again for joining. Gabe, any closing thoughts from you?
Some folks have asked about the recording. We will send it out on an individual basis. Anyone that wants it, you can request it. We'll also have it public in the future. And number two, a summary. We'll actually have a summary of this. And lastly, I'll end with a comment from Vince Vitale. He's in the gastro space. He said, adding multiple FTEs in the RCM department for each physician we hire is not a sustainable model. Automation is the only way we will be able to continue to grow as a physician practice. Well summarized, Vince. So I thank everyone. Thank you all for joining, and see you soon.
Take care.
Thank you.
Thank you.
Have a
Everyone,
great day.
take care. Bye-bye.
Good evening.
Thank you. Bye-bye.